Hello, my name is David Sallman from Moffitt Cancer Center in Tampa, Florida. It's really a pleasure to be presenting at this ASH 2022 Congress on an exciting CAR T therapy for relapsed refractory acute myeloid leukemia patients. So once AML patients fail standard of care, which can include intensive chemotherapy, HMA venetoclax, and/or targeted options, there's really a overall dismal survival, often in months, and really no standard of care in this group. And although CAR T therapy has brought forth a paradigm change and shift in the management of blood cancers, AML is still in its infancy, and we really need new therapies in order to improve how our patients are doing. So we present actually the first data on AMELI-01, which is a allogeneic, which means off-the-shelf CAR. We're using CAR T cells that were made from normal donors. And if you look at the structure of the CAR, it's basically been made to attack CD123, which is on the surface of the leukemia stem cell. And then these cells are also modified for safety. So one is they're modified so they cannot attack normal cells. And separately, we knock out a marker called CD52. This is so that we can add a drug called alemtuzumab to increase the lymphodepletion in order for these CAR T cells to better expand. So we really present the first both safety and efficacy data. This trial is still in dose escalation and has two cohorts, one with a 2-drug lymphodepletion and one with the 3-drug lymphodepletion with alemtuzumab. Overall, the therapy has been safe. We do see cytokine release syndrome. This is the most expected toxicity. It actually occurred in 100% of patients, and 4 out of 17 patients actually did have severe cytokine release syndrome. So again, I think this is something we have to look at improving safety over time. At the same time, we see really nice expansion in patients that get fludarabine, cyclophosphamide, alemtuzumab. The majority of these patients have expanded quite well, really speaking that this is doable and really kind of exciting early kinetic data. When we look at the activity, 2 of patients in that the cohort of 9 patients have responded. 1 really exciting response. So this is a patient who relapsed after transplant, had been through multiple lines of therapy, and had really horrendous blood counts. She was treated on this study, actually achieved a complete remission by the end of the first month, and she actually just had her 1-year follow-up and is in an MRD negative complete remission without any other therapy. So moving forward, we're still trying to further improve the safety. We're doing that by adding a preventative medication, tocilizumab, actually before we give the first dose of cells. And additionally, as this is an off-the-shelf product, to increase the efficacy, we're now going to be giving patients multi-infusions with the goal of improving ultimately the efficacy for this patient group. So we're excited by these data today, and again, look forward to treating more patients at Moffitt Cancer Center.